All right, welcome to the Explainer. Today, we're diving into something that's, really tiny but has this massive, massive power over the human body. We're talking about an electrolyte that's on a constant, high-stakes tightrope walk, where just the slightest tip of the scales can mean the difference between life and death. So let's get right into it.
So let me just start by asking you this. In this unbelievably complex machine that is our body, what single electrolyte, what one tiny little ion has the power to just stop everything? I mean, to literally stop the human heart from beating.
Well, it's all about potassium. Yep, the one with the chemical symbol K+. This is the electrolyte that basically governs the rhythm of our lives. And when its levels get out of whack, things get incredibly serious incredibly fast.
Okay, so Section 1, Potassium's Critical Balancing Act. Let's start with the absolute fundamentals. We're going to break down exactly what potassium does and why keeping it in balance is, well, absolutely critical for survival. So what is it? Well, potassium, or K+, is basically the king of electrolytes inside our cells. It's the most abundant one we've got in there. Its main job, making sure our muscles work the way they're supposed to. And I'm not just talking about, the muscles you use at the gym. I'm talking about your cardiac muscle, your heart, and all the smooth muscles lining your organs. Every single one of them depends on potassium to do its job. And check this out. Look at how ridiculously narrow that normal range is. 3.5 to 5.3. That's it. It's a razor-thin margin. So even a tiny little deviation, we're talking a few decimal points, can trigger massive, massive problems. When it comes to potassium, balance is literally everything. Now here's something that's really important to grasp, a key difference. Let's compare potassium problems to sodium problems. You see, when your sodium is out of balance, your body's main response is to shift water around. It's an osmotic thing. But with potassium, it's totally different. A potassium problem causes other ions to shift around. It's not a water problem, it's a cellular electricity problem. And that distinction is absolutely crucial. All right, Section 2, hypokalemia. So now that we get just how delicate this balance is, let's look at what happens when it goes wrong. And we're going to start with the most common imbalance you'll see, which is hypokalemia. That's just the fancy term for dangerously low potassium. The definition is super straightforward. Once your serum potassium level dips below that 3.5 mark we just talked about, boom, you're officially in a state of hypokalemia. So how does this even happen? Well, the causes usually fall into a few big categories. First up, you can lose potassium because of medications, things like certain diuretics, water pills, or corticosteroids like prednisone. You can also just plain lose it from your body through stuff like vomiting or diarrhea. And finally, big physical stressors like major surgery or a hemorrhage can just completely drain your body's potassium. Now, if you want a really easy way to remember the signs and symptoms, just think of the 6 L's. First, lethargy. You just feel totally wiped out. Then, and this is the big one, lethal cardiac arrhythmias. Next, leg cramps and limp muscles. This makes perfect sense, right? If potassium is the spark for muscles, not enough spark means weak, limp muscles. Then we have low, shallow respirations. And finally, less stool, which means constipation because, the smooth muscles in your gut slow right down. Okay, now here's a really critical connection you've got to remember. The body's pH balance is directly tied to potassium. Specifically, when your blood becomes too alkaline, a state we call metabolic alkalosis, it actually drives potassium into your cells, which of course lowers the amount of potassium left floating around in your blood. So how does that work? Let's walk through it. Step 1, your blood gets too alkaline. Its pH goes above 7.45. So your body's like, whoa, gotta fix this. To bring the pH down, it pulls hydrogen ions, which are acidic and positively charged, out of the cells. But you can't just leave an electrical imbalance. So to keep things neutral, the body makes a trade. For every positive hydrogen ion that leaves a cell, a positive potassium ion from the blood has to go in. And the result? Your blood potassium level takes a nosedive. So if there's one thing you take away from this section, make it this. Hypokalemia is a muscle and heart problem, period. The number one most terrifying danger is always a life-threatening arrhythmia.
Okay, so what happens when that pendulum swings all the way to the other side? That brings us to Section 3, hyperkalemia. This is when you have way, way too much potassium floating around.
So hyperkalemia is when your serum level gets above that 5.3 upper limit. Now, this is actually less common than low potassium, and there's a really simple reason why. Healthy kidneys are just amazing at filtering out any excess, which is exactly why you see this most often in patients with kidney failure. Their filters are broken, so their body just can't get rid of the extra potassium.
Besides kidney failure, the other causes are pretty straightforward. You can just be taking in too much, maybe from a lot of supplements or those salt substitutes that are high in potassium. Or you can have a huge shift of potassium out of your cells. This happens in things like massive tissue trauma, where cells burst open, or in metabolic acidosis, the exact opposite of alkalosis, where your blood gets too acidic.
And the signs? Well, they often start with muscle twitching and cramps. But then, and this is kind of interesting, that progresses to profound muscle weakness. Your heart rate gets slow and irregular, and your GI tract actually speeds up, leading to diarrhea. See how these are pretty much the exact opposites of what we saw with low potassium?
So the one-liner to remember for hyperkalemia is this. It's a result of either excess intake, your kidneys not being able to excrete it, or potassium shifting out of your cells. It's really that simple.
All right, section 4. Let's do a little showdown, a side-by-side comparison to really hammer home the differences between hypo and hyperkalemia.
This table just makes it crystal clear. It's basically a rule of opposites. Look at the heart rate. With hypokalemia, you get a weak, thready pulse. With hyperkalemia, it's slow and irregular. How about the muscles? Hypo gives you limp muscles and cramps. Hyper starts with twitching and cramps, then leads to weakness. The GI system? Hypo means decreased motility, so constipation. Hyper means increased motility, so diarrhea. And finally, the acid-base balance. Hypokalemia goes with metabolic alkalosis, and hyperkalemia goes with metabolic acidosis. It's like they're mirror images of each other. Okay, section 5, let's bring it all home. We're going to wrap up with the most important, absolutely critical, life-saving takeaways. These are the rules you just have to know. Okay, safety rule number 1, and please listen closely to this. Potassium is never given by IV push. Ever. I can't say that enough. You never, ever give it as a direct, fast injection into a vein. Pushing concentrated potassium straight into the bloodstream is lethal. It will stop the heart. It has to be diluted, and it has to be infused slowly over time. No exception. And here's the other huge safety rule. Before you even think about giving IV potassium to fix a low level, you have to confirm one thing. Is the patient voiding? Are they urinating? Why? Because if they're peeing, it means their kidneys are working. And if their kidneys aren't working, they can't get rid of any excess potassium. So your attempt to fix hypokalemia could accidentally swing them right into deadly hyperkalemia. So let's end on this thought. The body's balance really is this incredibly delicate dance. Now that you've seen the unbelievable power of this one single electrolyte, how does it change the way you think about patient care? I mean, really think about it. How does it change how you see the importance of a simple lab value or the risks of a common medication? It's a powerful reminder of how finely tuned we really are.